Welcome to our virtual career day series with the Los Angeles Public Library. My name is Lynn Nguyen, and I'm here with my co-host Jessica Levy from Palisades France. Say hi. We're
Hey.
so excited to have you all here for our weekly virtual career day series where we introduce amazing careers to you. Today we have two amazing guest speakers from the public health and healthcare industry here to share some tips, tricks, and provide you with some insight on how they got into their professions. We would like to extend our deepest thanks to all of you for being here today, our guest speakers, the Library Foundation, and the Friends of the Chinatown Branch Library for their generous support. Before we begin, I would like to go over some housekeeping rules. Your microphones are already muted, so you do not need to have, and you don't have to have your videos turned on. Recording is in progress. If you do wish to ask questions at any time during this program, you are welcome to type that in the chat box and Jessica and I will ask that question for you. Or you can wait to our Q&A and unmute yourself to ask your question to our guest speakers. So please don't be shy, we're all here to learn. And we hope that you enjoyed today's program. At the very end, we will be linking a survey in the chat box. So please do take a moment to fill that out for us so we can share your feedback with our guest speakers. So with that being said, I would like you all to open up your chat box. Yeah. The popcorn question for today is, what do you think is the biggest public health crisis that we're facing today besides COVID? So you can type it in the chat box. Ooh. There are so many great answers popping up. Wow. Okay, so, there's just so many. There's HIV, cancer, heart issues, chronic diseases, mental challenges. All right, so I'm going to introduce you guys to our first guest speaker who happens to work for the LA Public Health Department. His name is Bryant Dao. He is an epidemiologist born and raised in the San Francisco Bay Area. He currently works for the Rapid Assessment Training and Evaluation Unit at the LA County Department of Public Health, conducting and assisting in the design and implementation of rapid assessment surveys on emerging public health issues. In addition to his current role, he serves as the co-lead in special projects for the Outbreak Management Branch Data Science team for projects related to COVID-19 outbreak investigation activities. Bryant holds degrees in biochemistry and epidemiology from the University of California, Los Angeles, also known as UCLA. So Bryant, welcome.
Thank you for having me.
Yeah,
And
Bryant,
thanks for everyone for coming on.
Awesome. Bryant, what do you think of all the answers our amazing participants have, provided us here in the chat group?
Yeah, these are all very important things to consider because, I see a lot of cancer, global vaccination, nutrition, and since a lot of us are starting to live a little bit longer, there's going to be a lot more of a chance that we may develop that over time. And these are all very much things that in public health that we're trying to work on. And a lot of divisions within us are all collaborating and trying to address these issues.
Wow. Very, very, very cool. So we all know you work as an epidemiologist, and I know I read a little bit of your bio that talks a little bit about what you do at this moment, but let's go ahead and turn back time a little bit. Did you always know that you were going to be an epidemiologist?
Oh my gosh, I did not even know what epidemiology or public health was when I was a teenager or even in college. It only took probably a couple of years into college because at that time I was studying to be pre-pharmacy, trying to follow what my parents suggested, as all kids do. We try and make our parents, want to do what they want us to do. And I found out that wasn't really much for me. And I wanted to still continue to be in the sciences, So I found a job as a work study student in clinical research in a clinical research group at UCLA. And they were focusing more on drug therapies in post-transplant patients. So say herpes zoster or shingles, if that after transplant, are they able to have these drugs prevent them? So that was another vaccine trial. So during that time, I'm kind of just learning this whole process. There's really cool like little cogs in the process, like shipping specimens, entering data, learning more about like these disease processes and stuff. So there was a little bit that was like jogging my brain. So maybe this could be like an interesting thing to do. So like fast forward, I take a public health class in still at UCLA during the summer. And it was more of like a broad issues. So they talked a lot about each of the disciplines of public health. So there's biostatistics, there's community health sciences, there's epidemiology, which I'm in now, which I didn't know back then, environmental health, and like health policy and management. And there was this little part where the professor was talking about epidemiology that said epidemiology is about the study and distribution of diseases and exposures in the population, and a lot of some of the interventions that they do. So that kind of like I was like kind of clicked my head a little bit, because the things that I was doing was kind of like similar sides of the same coin. You know, I'm doing research, I'm doing this whole process of trying to find this answer to this research question. So I got this little got a little stew going essentially, and kind of made me more interested on why like certain studies were even designed this way. So like, why do drug trials, why are they called double blind, or why are they randomized, or like why do they try and recruit people in certain ways? So fast forward a little bit longer, this is a very involved process, and I meet an actual professor in epidemiology in the same research office. So just a chance encounter. And I asked him, okay, so like, what does like public health and what does epidemiology like mean to you? And he responded with a more of a parable. And he talked about, okay, say that you're walking up a river, going upstream, and you see someone who fell into the river, and you go in and you save them from drowning. And you keep going up the river, and you keep seeing people falling into the river, and you want to save them. Keep going, and you kind of start wondering why, like, oh, why is this happening in the first place? So he kind of equated that saving that person, which is very important, which is like being the medical person, like being the doctor, being the nurse, saving the person, and that's downstream. But going upstream, as in public health, we want to identify like, oh, what's like the cause of the cause? You know, what can we do to try and prevent as much as that from happening? So I guess for an example, like saving someone downstream of the river, maybe that could be, say, obesity or like nutrition. We keep going a little bit. So they're treating the effects of obesity, but if we keep going upstream, we're trying to identify like, oh, maybe we can help with more people if we say connect them to programs, or if we go further back, start looking at like policies in terms of food, in terms of like food deserts, in terms of availability for healthy foods for these communities. So that like really blew my mind when that professor told me that. So I really wanted to kind of be that guy who was a little bit more upstream. So that's why I decided to go back into grad school at UCLA to go into the Masters of Public Health, because that's kind of the upstream part that I'm really interested in.
Wow, that I love your story. That's so amazing. And thank you for sharing that. That definitely answers a lot of the questions that I was about to ask you next about that aha moment. So, what was you said you went to UCLA. Did you go right after high school?
I did go after high school.
Okay. And what was your I'm sorry, what was your undergraduate degree in?
It was in biochemistry.
And
So
then
like,
and then you went to the master's in public health.
mhm.
After you finished grad school, did you apply for any internships, or did you go straight to LA County Department of Public Health to work as an epidemiologist?
Yeah, so the great thing about going to the master's program at UCLA is that during the first and second year in between, we are supposed to go on an internship for like our capstone project. So I had the opportunity to um, work at Cedars-Sinai on another range of epidemiology, so like cancer epidemiology. And my investigator, she was more interested in are there any certain biological markers in liver cancer patients that we can use to predict like uh, and detect liver cancer from happening in the first place.
Wow. How long have you, and then after you did that, you went straight to work for the LA County Department of Public Health as an epidemiologist. How long have you been working for LA County Public Health?
So I've been in the same team for about 4 years now.
How was it for you when COVID-19 happened? And
Um,
then how did your job shift change? Like what were you doing before COVID-19 happened? And then how was the transition to helping with this whole entire team that you're running for the COVID-19 assessment team?
Yeah, so I guess fundamentally, the principles of research is still there. So even though before COVID, we were working on a lot of different projects. For example, we were working on like a traffic safety project, one for persons experiencing homelessness, and all of that kind of has the same process of like identifying the problem, trying to develop like a protocol, trying to develop the survey, setting up the survey, implementing it, and doing the data analysis. But now, because of COVID, a lot of us have been shifted towards working on COVID-related projects. So a recent one that we've been working on is that with the infectious disease division, they were interested in pregnant mothers because they were noticing there might there might be a pattern of early outcomes or adverse outcomes in delivery of children or delivery of infants. So we're working on that. Currently, there's still a lot of work that still needs to be done in terms of that. In addition to that, we do a lot of like monitoring, like vaccine data, trying to interface with the nurses over at the vaccination sites and making sure they have enough vaccines for everyone who's registered at these sites.
Wow. What are some of the challenges you face as an epidemiologist and some of the rewards?
I think I think the challenges in general for public health is that um, you know I personally want to see things improve very quickly and not like and not have it slowly over time. But that's kind of how the nature of public health is and epidemiology is. It's a marathon. It's not a sprint. And we have to stay focused. We have to still keep believing that we can still make that greater change over time. So that's kind of the rewarding part of it. It's just playing the long game, essentially.
Mm. For teams that want to go into this type of career field, do you have any tips or suggestions or resources that you can offer to them or
Yeah,
advice? Mhm.
yeah. So definitely explore what certain things that you are interested in. It can be something about your community. It can be something that you may have experienced, and reach out to some of the programs at Los Angeles County. They have a ton of different programs in terms of what they research. There's nutritional, there's nutritional epidemiology, there's maternal health, there's occupational related things, there's infectious disease. So I encourage you to reach out to any of the teams over there. There's also internships and volunteering opportunities available. I guess after the chat, I can either send the link to Lynn and redirect it to everyone to see if anyone who's interested in joining.
Absolutely. If you're able to share that, I know that the teams would really, really appreciate it. So I guess, do you have any career highlights as of now that you something that happened to you recently where you're just like, wow, this is why I'm doing this. Like, I love my job.
Oh, goodness. Because of COVID, it really just opened up my eyes on like, wow, okay, we do need to have a lot of buy-in in terms of everyone working together. And just being out at the vaccination sites and actually seeing this all happen. So as a county person, we all are required to go help out these vaccination sites, and actually seeing that happen, actually people seeing vaccinated and just like being so happy as they drive away is very, very rewarding, because we're kind of seeing like things changing. We're like being part of history in a way. And we're seeing like that light of the end of the tunnel when you see all these efforts that we've been putting in.
Mhm. Thank you. What do you think teams will gain from becoming an epidemiologist or someone that is researching information to help the public? What attributes do you think what attributes do you think is important for them to have?
Yeah, definitely someone who's in general like very detail oriented, really likes to focus on data, and also use that data and I guess reinterpret that and be able to explain it to a greater audience. So that communication is very, very much key.
Mm. What are some things that, how do you define success in your job?
No, that is challenging to think, because a lot of our projects are very much long term, and I hope to think that after a long time that these projects can be successful. But unfortunately, you kind of win some battles, you lose some battles. For example, we've done a project on this battery recycling plant in East LA called Exide. And we were working on that rapid assessment survey and wanted to kind of show with our data that the effects of this battery recycling plant, the pollution that was giving out into the community, was affecting the community. The lead led to adverse and just like bad health outcomes for the community. So we gave all this information, and we wanted it to kind of push that and actually drive the change for that Exide plant to actually clean up the community. But unfortunately, in the past year or so, that did not work out the way that we wanted. And they were able to get a slap on the wrist. So, so it's hard with the long game, because sometimes it's just kind of how it is, that how it happened. But like when there's actual policies that seems to be working, or the things that we've been working on, it can be really satisfying, especially with COVID, with the vaccinations.
Mm. When you run into these types of obstacles, how do you overcome the challenge within yourself?
Well, I guess the issue is that we're trying to do our best that we can, and there's so many things that we need to focus on as well. And just having that drive and passion of thinking, okay, I don't want this to be a complete obstacle because there's just so much more that needs to be done in this community.
Mm. What are some things that you do for self-care?
I do, as you like to do. We both like to run. It's very therapeutic. Just running and just not even thinking. You just kind of going. It's very relaxing.
I agree 100%. If you could turn back time, what is something you wish you could tell yourself?
I wish I can tell my younger self to not be super stressed on what I think I need to be, what and have like that that I need to be a pharmacist. I need to be this. I need to be that. I want to tell my younger self to be much more flexible, because in the end, some things might not be the best fit for you, but when you start exploring different types of things, then it'll start to click. Some things may happen by chance, or things maybe just start to stack on top of each other, and then finally be like, oh wow, yeah, that sounds like it's something for me that I like to do. And yeah, just don't stress yourself out too much. You got a long time to really figure out what you really want to do.
That's great. Do you have any other last words or advice that you want to share with our teams?
Just public health is just everywhere around us, and it's everything in what we do. It's in the policies. It's in the way that we treat each other, the way that we all put on our masks, do our social distancing. So ultimately, really, we're all public health practitioners. And ultimately, we are not healthy until all of us are healthy. And I really believe that we are inching closer to that we are going to ultimately be as healthy as we can. And that's the fight that I really want to continue fighting. And I hope some of you can join too.
Absolutely. Thank you so much, Bryant, for just being with us today and for sharing your life experiences with us and all of the teams here in the audience. I'm going to turn it over to Jessica to interview our next guest speaker. If anybody has any questions, please do feel free to type that in the chat box. Thank you, Bryant.
Thank you for having me.
Wow, that was great. Thank you so much. So I'm really happy to introduce our next guest, who's Kelly. And Kelly Peng is a Michigan-born Chinese American who migrated to Southern California for college. She currently works at City of Hope Comprehensive Cancer Center as a clinical research assistant in outcomes research. Her current role involves collecting data from medical records, managing specimen collection, and recruiting patients for NIH-funded research studies. Kelly's passion for research is rooted in her belief that everyone deserves just, accessible, and equitable healthcare. Wow. Thank you so much for joining us today, Kelly. And it looks like you're coming to us from your work environment.
Yes, this is my lab.
Wow.
Thank you for having me.
You're welcome. Are you very socially distanced in your lab right now?
There's actually nobody else in here, so it's just me. The janitor might come by later on, but other than that, it's just me.
Okay, great. So please tell us a little bit more about what you do.
Yeah, for sure. So I work as a clinical research assistant, and my job has a lot of different hats. So one of the things I do is I collect blood from patients, and so that's one of the research studies I'm working on. Another one of the research studies I'm working on is I recruit patients for a brand new study that we're doing where we're looking at the heart and lung function of patients as they undergo transplant, and in particular stem cell transplant. So we do an exercise test for them, we do some functional tests, and then we see them again after their transplant at several different time points. So my job is to call them and to sell them our research study. when they agree, we bring them in, we see them for their study visit, and then we coordinate their next visits and kind of continue that care with them. I also work on a lot of like data entry things and then do some data abstraction as well from reading medical records. And so, yeah, a lot of different things.
A lot of different hats. So right now, although you're alone in the lab, what is your work structure? Do you work with a team of people?
Yeah, so I actually work with a team of about 15 to 20 people. Most people are actually working from home right now because of COVID. With my role, because it's so patient facing, I'm about 50% on campus. So in the mornings, I usually work from home, and then I'll come to campus to collect my blood every day. Or sometimes it's a longer day if there are more patients. Yeah.
Okay. And so we pointed out that you migrated to Southern California for school. So walk us back to your journey to where you are now. Where did you go to school and what did you study?
Yeah, so I went to Scripps College in Claremont, California. I studied Asian American Studies and biology, and I did a dual major. I knew I was really interested in public health, and that's kind of what I wrote my thesis about in college. And so I was really excited about that. I also thought I wanted to be a doctor back then. So I did all of my pre-med classes. And after graduation, my grandpa got really sick, and I was supposed to move back to Chicago to start a job there. But given that he was sick, I wanted to stay a little bit closer to home in San Diego, where my parents are right now. And so I started looking for jobs around here, and luckily somebody who also went to Scripps worked in my office. And so I reached out to her using that connection. That's how I kind of ended up where I am. And I've been here for a little over 3 years now, and have really learned a lot. So I didn't know I was going to be a researcher. I actually thought I wasn't smart enough to do research. And yeah, so now I'm a published author.
Wow, congratulations.
Thank you.
What journal might we find your work in?
You might find it in the Blood Bone Marrow Transplant Journal. We also published in Nature last year. So we've been in a few different publications. And, yeah.
That's great. That's really, nature is huge. So you mentioned that originally in college you thought about pursuing medical school. At this point, have you put that behind you? Is that still an option in your mind? Or what path do you see yourself going on at this point?
Great question. I thought I really wanted to go to medical school. I took the MCAT, I studied for it again, and was going to take it again. And after being in my role and doing the medical record abstraction, where I literally read medical records for patients and kind of seeing how doctors actually work on a day-to-day basis, I realized like that's not what I wanted. And I didn't want to be a research physician either. I really wanted more patient care. And as I've been in research longer and interacting with patients longer, I've come to realize that I actually really enjoy the patient aspect. And so last fall, I applied to nursing school to do a master's in nursing, and I'll be starting this fall at UCLA, actually.
Oh, congratulations.
Thank
Ooh,
you.
UCLA. So I was going to ask what are the highlights, but it sounds like for you, one of the highlights is probably direct patient interaction. And yeah. So have there been any major highlight, like particular highlights or things that you would point to as like, this is the really rewarding aspect of my job since you've been working in the lab?
Yeah, I mean, as like cheesy as it sounds, I really do think working with patients on a day-to-day basis is really rewarding. And when we see them before their transplant and then at 6 months after, when they're feeling much better and they're doing much better, it's really rewarding to see that these therapies are working and that they're getting better. And it's the physical manifestation of all the medical records that I read through when I first started in this job. So when I first started, I didn't have a lot of patient interaction. I didn't even interact with my coworkers very much, just based on the nature of my work. And so because of how like outward facing my job is now, it's been interesting to see all of the things that I was doing before come to life. And like these patients are real people. And so that's been really rewarding to see.
Yeah, that's great. And what have been some of the bigger challenges in this job?
Yeah, I think COVID has been a challenge for us as well. I think it's been a lot harder to recruit patients. We also take a lot of additional measures now to make sure our patients stay safe. And so that means doing COVID testing 2 days prior to seeing them. Scheduling has been a nightmare just because of balancing all these different things and balancing when a patient can actually come to campus. And so there's a lot that goes into research that I don't think we think about on a day-to-day in terms of like physical logistics, like how can we make this research as accessible to as many people as possible? How can we make sure that like people understand what we're doing and feel comfortable and don't feel like they're being mistreated? Yeah.
And the fact that you work in a cancer with a lot of cancer patients, like how does that have any effect on your job and any emotional baggage?
Yeah, I mean, with COVID, cancer patients are immunocompromised, and so they're especially susceptible to being exposed to COVID. I think it has been challenging sometimes when patients pass away before we're able to see them, or when they're people I've actually consented and met in person and then they pass away. It is pretty sad, and I think that death it's the reality of the job, but it also is important because it helps shape how we treat patients in the future.
That's beautifully put. So you're somewhat relatively recent, more of a recent graduate than I thought. So during college, did you have any other internships or experiences that kind of were guiding you at that time, whether it was towards med school or even into research?
Yeah, I didn't do any research in college. So anyone that tells you you need research experience, you have to start somewhere, right? And so the only research I did was on my thesis, which every person is required to do. You basically write a long paper and do a lot of research about a certain topic. Mine in particular was about breast cancer in Chinese American women in the San Gabriel Valley. And that was based on my experience doing citizenship coaching at the Monterey Park Library. And so every week while I was in college, I went to Monterey Park. I did citizenship coaching with some of the immigrant elders and coached them for their citizenship interviews. And so doing that, also having grandparents that went through that process, made me realize that health comes in a lot of different ways. And I think that's what really planted the seed for me for public health. And then I also volunteered at City of Hope when I was in college because I was a pre-med. And then I also worked at a summer camp during all the summers between college, and that was in DC. That was a fun time to meet with more high schoolers and kind of like help them find their career interests.
So to everyone in the audience, I hope you're hearing this. You know, it's good to, like Kelly, she explored a lot of different avenues and you worked with so many different multi-generations that it really gave you a lot of experience, it sounds like, to see what you thought you might like doing. Going even further back in high school, just out of curiosity, did you see yourself headed in this direction? And was your family involved in any way? Did you feel any kind of pressure to go in the medical direction?
Not so. My parents owned a restaurant when I was growing up in Michigan, and that's all I knew. I knew the restaurant life, and when I told them I wanted to be a doctor, they actually told me not to. They told me it was too much work, too much stress, and like when I was crying over taking the MCAT, they were like, "Don't do this to yourself. Like, go do something easier. Go like find a rich husband." And I was like, "No, like I want to do something for myself too." And so that's kind of, and so honestly, their discouragement made me feel more driven towards it. And then I realized like, okay, maybe this med school thing might just be like me trying to prove a point. And so I think working in research has been really helpful because it's given me so many different ways to explore and grow and figure out what I actually am interested in. And med school wasn't it. So
yeah. Thanks. And I know like Bryant and Lynn here, you're also a runner. So including has running, or do you have any other hobbies, things that have helped you kind of deal with the everyday stresses and pandemic life?
Yeah, so I do run a lot. And then I also like checking out books from LA Public Library. And so I read a lot in my spare time, and then I watch TV as well.
Yes, I wanted to point out to everybody too. I heard you say that you worked, you talked about how you worked with elders at the Monterey Park library. And I thought that was another beautiful example of libraries as a way to connect people and just to give you like volunteer or work experience. So thank you for illustrating that point. We did not pay her to say that. And I guess, is there anything you wish you would have done differently in the past as far as exploring careers? I mean, you've already done so much and you did a lot of exploration as it was, but you know, I'm sure hindsight always provides some insight. Is there anything you would do differently or recommend to someone else getting started in college? Like, please explore as much of this as you possibly can.
Yeah. I mean, I think I used to stress out a lot about like the little things, and I would say like the little things all make up this big picture, right? And so I think it's important to keep that big picture in mind and take the little things as they come and kind of just like roll with the punches, because as like with COVID, we didn't expect this. And so that's been something to adjust to, but it's also been why I'm working with patients now. And so I think something I wish I did is I wish I tried to go to more events like this. I wish I talked to my professors more. I was so scared of like not being good enough for some reason. I wish I would have just like talked to my professors and tried to get opportunities to do research. And I think like definitely take advantage of as many opportunities as possible, but make sure that you're still taking care of yourself, meeting your own needs, and like getting breaks and taking rests as well.
I think you said something earlier. I think it's fairly common, and especially in one's 20s, like when you're in college, thinking that you're around so many brilliant people that you are constantly comparing yourself and may feel more insecure. And you mentioned not feeling at that time like smart enough to go into research. What about research seemed like, oh, that's not for me, that's for this type of person?
Yeah, I read a lot of research journals as part of like my science classes. That's what science at liberal arts colleges is. And so while I was doing all of these like research journal readings, like I didn't understand any of it. I was like, this is all going over my head. And when we would discuss these in class, I would get so confused. And so I think it's like finding study groups and breaking it all down and trying to understand it together. And also knowing that like a lot of people are in the same boat, and a lot of people read these things and they're like, oh, I don't really know what that meant. And so I think taking it again, like taking those things in stride and trying to figure things out as they go. Yeah, I mean, I think I was really insecure about like not feeling smart enough, because there were all these big words. There's like all these different barriers to accessing science, especially if you're a person of color, especially if you're a woman of color. And I was a first generation college student, and so I really didn't know what I was doing. And so I think, I mean, luckily I had faculty mentors that were really supportive of me and told me like, you know what, you can do this. You're really smart, and like you should try and seek out these opportunities. And so like, don't let rejection get you down. And like, yeah, I think there's a lot of things that will try to like push you back, but like, don't let them stop you.
Good advice. So we know nursing school is in your future. Do you hope to continue with research as a nurse? Although we often ask like, what do you see yourself doing in the future? 5 or 10 years down the road. This isn't a job interview, so we won't hold you to it. But if you have a vision for yourself, where do you see yourself?
Yeah, I definitely think I want to incorporate research into my future like nursing practice. And so I'm interested in possibly pursuing a doctorate degree further down the line. I think while I'm still young and able to like move around and get around, I think it'd be really nice to be able to spend some time at the bedside for nursing. And then eventually, as I get older, less mobile, then hopefully do more research and maybe even focus into like teaching.
On the public health side, just keep staying active, and then you won't necessarily be less mobile.
I just have to keep running.
Keep running or walking. And do you have any idea of what kind of nursing you want to do?
Yeah.
Like, do you want to work with certain populations?
I think vulnerable populations as well as underserved communities, especially knowing that when I was growing up, sometimes there was like a language barrier between my healthcare providers and between my parents. And so definitely thinking about different ways to make healthcare as accessible as possible to as many different people as possible.
That sounds great. Well, thank you, Kelly. Do you have any final words before we open it up to the questions that you want to impart to our audience today?
No, I mean, really just like, thank you for having me. I think we really get caught up in like, this is what we're supposed to do. I personally really liked having like these steps to follow. And that's kind of how I fell into being a pre-med and stayed pre-med for so long. And so I think it's like, my parting words, I guess, would be to be uncomfortable with not knowing what you're going to do and be comfortable with like being uncomfortable, and know that like whatever you're doing is right for you and hopefully the right things will come along.
Well stated. Thank you so much. If anybody has any questions, now is the time you can either pop it in the chat. If you want to get on the mic, you can raise your hand and we'll unmute you. Does anybody have anything they want to ask? It could be about the schools. It could be anything.
I love their energy so much. Kelly, I wanted to ask you, are you able to give us a little peek into what's behind you in your lab? It looks so cool.
We have a water purifier thing over here. I don't know how to use that. We have pipettes and micro pipettes over here. So this is where I separate my blood into different aliquots and store them into the freezer. I'm at a desktop, so I can't move it, but our freezer is like right over here. We have a -80 freezer, so very, very cold.
Wow, thank you. All right, looks like we have a question here from Daisy. Did any of you take AP Stats in high school? Bryant?
I did not.
Did you take any? Oh yeah, I was gonna say, did you take any AP classes at all?
Yeah, I took AP classes. Yeah.
What AP classes did you take?
I took AP English, AP Calculus, AP US History, and AP Biology. So we didn't like my school didn't offer a whole lot, but that was kind of the gist of it.
How about for you, Kelly?
I think I took most of the ones my school had. I took AP US History, AP World, AP Psychology, AP Statistics, AP Calc. I didn't transfer any of my AP credits though, so they kind of became useless to me in the end. Maybe not super worthwhile to like stress over them completely, but yeah.
Good to know. Good to know. I hope that answers your question, Daisy. We have a question here from Ed for Bryant. What was harder, undergraduate or graduate school at UCLA, and why?
I'd say graduate school was easier than undergrad. They're more in lines of like wanting to teach us how to just become more engaged in the community and just be more engaged in research. And so they weren't as like very strict on grades or anything. So it made it a lot more relaxed for everyone to just learn as much as we can and explore like certain options that we wanted to do, as opposed to undergrad where it can get very competitive and you could be in an environment of different people that have different goals and stuff.
Awesome. Thank you for sharing that. Do either of your labs offer programs for students who want to experience working in a lab or a research environment? That question's for you, Kelly.
Yeah, I think there are internship programs for high school students, definitely also for college students. They do like a summer internship program. So that might be something to look into.
Cool. Is that on like the City of Hope website or? Okay, great. We'll link that in the chat box. And how about for you, Bryant? Does your organization offer internships or lab programs for students to work in your lab?
I think there might be a possibility. We do have a public health lab that is in Downey. So it could be an opportunity to just reach out to them to see if students are allowed to come in.
Okay. This question here is for Kelly. Miss Peng, what types of challenges or stress did you face when going into med school? This is from Francia.
Oh, the MCAT itself is such a challenge. It's a 7-hour test, in case you didn't know. And so studying for it means getting used to that like time period. So studying for the MCAT was hard. I think for med school, I think there's just a lot of components to the application that also make it kind of difficult.
Is that the janitor? Okay. Just kidding. Put on your mask. It's cool. Okay, this question is for Bryant from Dr. Dang here. The question is, have you heard of news to increase genetic testing of COVID to track which mutations are infecting the local population?
Oh, that is a good question. I'm not too sure that I've heard too much about it, but it is incredibly important because of the UK variant, the South African variant, and the Brazil variant can spread much more quickly. So that is definitely something that I want to check with my supervisor or just higher up to see what sort of things that they're going to do to track the mutations. So that's a good question.
Okay, great question. This question here is from Margarita. What is it like for public health professionals when COVID first came around? I'm picturing everyone just frantically trying to find a cure, but I'm sure there's a lot more to it than that. So how was it for you, Bryant?
Oh, it was very frantic. But no, fortunately, we are a huge group of very, very, very smart, intelligent people that are trying to tackle this pandemic. And in the very beginning, we didn't have a whole lot of information to go on. So a lot of it, we're just trying to figure it out as we go. So we're trying to use just prior information, like, oh, how does COVID transmit? What's the clinical process of it? And then we got to figure out, okay, so what's the best way that we can do to kind of reduce that transmission, trying to reduce it in communities that are hardest hit, which is usually more of lower income households and more in communities of color. So there's a lot of things that we had to frantically kind of piece together. But as we got on further into the pandemic, we got a lot more comfortable in trying to having those established protocols, the established kind of information, and we're just kind of building and building and building to actually kind of try and end this pandemic.
Thank you for sharing that. So this question is from Malia. How do you guys deal with stress? I always hear that the medicine, health, and research fields are super stressful. So do you have any good methods or mindsets to keep? I'll throw this out to Kelly first.
So as Lynn mentioned, I go on runs. I also sometimes go on walks because sometimes running just feels like too much. And so when I get home kind of late, I'll just go for a walk down the block and then come back. I also journal, and so that helps me process a lot of the things that I'm feeling and experiencing. And then I just try to remind myself to take a deep breath every so often and breathe it out.
Thank you for sharing that. How about with you, Bryant?
No, I guess very similar things in addition to the running, just kind of meditating and just kind of, thinking that, we can't save the world at instantly, it's just, you got to take it one step at a time. And, you can't put that pressure on you to think that you can just do that Herculean task.
Thank you. And then if you guys do take a look at the chat box, Jessica has linked in the City of Hope opportunities. So make sure you guys take a look at that. It may offer some internship opportunities for students. All right, Diana here has a question since you guys both went to UCLA. Any tips for the college process or college application process? We'll start with you, Bryant.
Well, I went to college in 2000. 8. So was it like
we're so old.
years ago? So maybe things have changed a little bit since then, but I think, you know, when I was applying for undergrad at UCLA, you know, I tried to do my best in my classes, chose classes that I was interested in, chose extracurriculars that I was interested in as well. And at that time, I was very interested in theater and like using kind of, you know, other activities and kind of make yourself a little bit more well-rounded. And I wouldn't say like my test scores were like super competitive either, but you know, it was kind of like a Hail Mary when I sent in that application to UCLA, and I was very, very lucky to have gotten the acceptance.
Awesome. How about for you, Kelly?
I didn't go to UCLA. I didn't even apply to UCLA for undergrad, but I did work in admissions when I was in college. So just a admissions tip is, like Brian said, like definitely get involved in different things and figure out how to talk about yourself, because you'll have to, and definitely figure out how to like write about yourself and write about your story and figure out like what those things that make you are. A lot of colleges do review holistically, so I also didn't have great test scores. So they look at you as a whole person. Hopefully in the future, college like admissions tests won't even be a thing, but
So that's great advice. Okay, we have a question here from Ed, and this is for Kelly. How long will it take for your nurse? How long will it take for your nursing degree? So I'm assuming how long will it take for you to get it? Do you foresee it being hard to go back to school after being in the working world? And congrats to you, you read really fast.
It'll take 2 years. It's a entry-level master's program for people who have bachelor's and other things to do nursing. So it'll take 2 years. It will be an intense 2 years. I did take a whole year's worth of prerequisites while I was working full-time and training for a marathon. So I think that definitely helped push me to really like it pushed me to sleep less, but also to balance things. And so I think school at a nursing level will be a little bit more challenging than my prereqs, but I think I'm ready.
Yes, we believe in you. We know you're ready. For Kelly, this is from Nikki. What was your undergraduate major? Was your undergraduate degree STEM related? And how was that experience at a liberal arts college?
Yeah, so I was a dual major in biology and Asian American studies. So 2 very different things. It was part STEM and then part humanities. STEM at a liberal arts college is interesting. I think I didn't realize this until I started taking prerequisites at community college, but my classes at my liberal arts school were a lot harder, especially the science classes, because they teach you to think about science in a really conceptual way and in a way that teaches you how to think. And so I didn't realize that at other schools, everyone had just like fill in the blank or like multiple choice test questions for their exams. Mine were all short answer. And so every single test that I took for a science class in college was a short answer test. So I couldn't just guess. I had to really think about like the question, even when I had no idea what the answer was. And so science is definitely challenging, but the classes are smaller, and that's really why I chose liberal arts college, was so that I would have smaller class sizes. My biggest class had like 50 people in it. Most classes were like 20 to 30. And so my professors knew when I wasn't there, and it was really cool being able to get to know them and to have that personal experience and to be able to network, but also like build that connection.
Awesome. Here's a question from Jessica. How do you feel that your college set you up for getting a job, and what would you suggest for how to get one out of college? I'll start this one off with Bryant.
Okay, that's a great question. And for college, I would encourage people to reach out to like the career centers at your college. I was able to find my job through the Career Center through UCLA. through like the work study program and through its affiliation with the school. So I think that would be like the first entry point of just if you want to find a job that's in a field that you're interested in, find the one closest to you, to your school.
Okay, awesome. And how about for you, Kelly?
I use the career center at my school, and then we also had like a job board called Handshake where I looked for jobs. Where I actually ultimately found the job I'm working in right now, though, was on Facebook in a alum group for Scripps graduates, and somebody posted the position, and I messaged them and said I was interested. That's how I ended up here.
Wow. So social media can be a really great tool for finding your next job. Thank you for sharing that, Kelly and Bryant. I know with our past guests, they've also mentioned reaching out to people through even LinkedIn. LinkedIn is a social network for the job market. People that are interested in looking for recruiters or looking for people that works for a specific organization, you can reach out to them through there. Okay, this is question from Dr. Dang for Bryant. Are there any plans to reach out and educate the public to address concerns about the COVID vaccines?
Ooh, yeah, that is a really good question. And you know, that definitely highlights the need for to educate communities that you know, lower income communities and people of color. And you know, as much as I want to believe that I can just walk into a community that I am not familiar with, or I don't, you know, share their common experiences, I won't be able to convince them at all. So there's going to be a lot of the need to build that trust into the community, try and find like community or people in the community who are interested in buying in and trying to convince their peers and to just educate them about the COVID vaccines. So we want to do more of like the community building component, and in order to increase like the education and to address these concerns.
Mm-hmm. Thank you for sharing that. I hope that answers your question, Dr. Dang. All right. I know we're running towards the end of our program here. Are there any last minute questions that you guys have? You know, we're here to help, so please let us know. In the meantime, I just wanted to share next week we'll be having two awesome guest speakers, also from my Run Club. We'll be having a film director and also an artist and entrepreneur. They're both dear friends, and they you know, have a wealth of experience in the art and film industry. So I hope that you'll all be able to attend our Career Day program next week on Wednesday at 4 p.m. In the meantime, we have linked in the survey in the chat box, so please do take a moment to fill that out for us and for our awesome guests here that are here with us today. Thank you so much to Kelly and to Bryant for just sharing everything with our teens and our community today. We're so appreciative. Yeah, look at that. Oh, everyone says thank you. Jessica, any last words?
I echo Lynn. Thank you guys so much for taking the time out of your workday to talk to us and impart your wisdom. We really appreciate it.
Yeah, we really, really do appreciate it. Oh, the box is going crazy. Everyone is shouting thank you to you guys. Yeah, Terminator Bryant.